Colon cancer is one of the most widespread and life-threatening cancers globally, yet awareness about its symptoms remains alarmingly low. Recognizing the early warning signs is absolutely essential, as catching the disease in its initial stages significantly improves treatment outcomes and survival rates. In this video, we will explore 11 crucial symptoms that may indicate colon cancer, symptoms that should never be dismissed. Early action can save lives, and your health is far too important to overlook. Colon cancer develops in the large intestine, the colon, which is the final part of the digestive system. It often begins as small, non-cancerous growths called polyps that form on the inner lining of the colon or rectum. While polyps are usually harmless, some can eventually turn into cancer if left undetected and untreated. This process can take years, which is why regular screenings are vital for identifying polyps before they become malignant. Although colon cancer primarily affects individuals over the age of 50, cases among younger adults are becoming more frequent. Understanding how this disease progresses and its risk factors can empower you to take preventive measures and protect your health. Just a quick reminder, we are not medical doctors. This video is for informational purposes only. Number 1. Changes in bowel habits. One of the earliest signs of colon cancer is a noticeable change in your bowel movements. This can present in several ways: persistent diarrhea or loose stools lasting more than a few days, chronic constipation that doesn't resolve with usual remedies, a sense that you cannot fully empty your bowels after using the bathroom. If you notice significant and long-term changes in how frequently you use the restroom or the texture of your stool, it's important to seek medical evaluation. Stool that appears unusually thin, ribbon-like, or has a different color like pale or dark tones could also signal something abnormal in the digestive system. Number 2. Blood in the stool. The presence of blood in your stool is a concerning symptom and should never be ignored. Blood can appear in various forms. Bright red blood usually points to bleeding in the lower digestive tract, such as the rectum or colon. Dark or black stools may indicate bleeding higher up in the gastrointestinal system. While blood in the stool could stem from less severe conditions like hemorrhoids or minor tears, it can also be a warning sign of polyps, tumors, or advanced colon cancer. Any evidence of bleeding should prompt an immediate visit to your doctor. Number 3. Persistent abdominal pain or discomfort. Chronic abdominal discomfort can also be a sign of colon cancer. Symptoms may include cramping, bloating, or excessive gas, a dull, aching pain in specific parts of the abdomen, a persistent sensation of fullness or unease in your stomach. Unlike temporary indigestion, the discomfort associated with colon cancer tends to be more frequent and intense, often interfering with daily life. If you're experiencing ongoing abdominal pain that doesn't resolve on its own, it's time to consult a healthcare professional. Number 4. Feeling of incomplete bowel emptying. If you feel like you still need to use the restroom even after a bowel movement, it could be a symptom of colon cancer. This persistent sensation, known as tenesmus, can be frustrating and disruptive. It may indicate a blockage or tumor within the colon or rectum that is preventing normal evacuation. While occasional feelings of incomplete emptying can happen to anyone, persistent and worsening symptoms should not be ignored. Number 5. Unexplained fatigue or weakness. Fatigue is often overlooked but can be a significant indicator of colon cancer. This type of tiredness goes beyond regular exhaustion. It's a constant, overwhelming sense of fatigue that doesn't improve with sleep or rest. Colon cancer can cause blood loss over time, leading to iron deficiency anemia, which depletes your energy levels. Common signs include feeling weak and lethargic throughout the day, shortness of breath or dizziness with minor activity, pale skin or brittle nails. If fatigue becomes persistent and doesn't have an obvious cause, it's important to get evaluated by a doctor. If you're finding this information helpful, please hit the like button, subscribe, and turn all notifications on to stay updated with our latest health and nutrition tips. Number 6. Unexplained weight loss. Losing weight without changing your diet or exercise routine can be a red flag. Unintentional weight loss may occur because colon cancer affects the body's ability to absorb nutrients. This can lead to a reduced appetite or aversion to food, muscle loss, and a noticeable decrease in body weight. If you lose more than 5% of your body weight over a short period without trying, it's worth discussing with your healthcare provider. Number 7. Anemia and pale skin. Chronic bleeding in the colon can cause anemia, a condition where your red blood cell count drops. Signs of anemia include persistent fatigue and weakness, dizziness or lightheadedness, a rapid or irregular heartbeat. Anemia caused by internal bleeding may not always be obvious, which is why it's important to seek medical attention if you experience these symptoms. Number 8. Pencil-thin stools. A change in the shape or size of your stool, particularly if it becomes pencil-thin or ribbon-like, could be a sign of a partial blockage in the colon. Tumors that grow inside the colon can narrow the space available for stool to pass through, causing it to take on this thinner shape. Temporary changes in stool size can occur for other reasons, like diet or hydration, but if this persists, it warrants further evaluation. Number 9. Skin changes Trelate sign. The Trelate sign involves the sudden appearance of multiple seborrheic keratosis benign, wart-like skin growths. While these are usually harmless, a sudden increase in their number or inflammation could indicate an internal malignancy, such as colon cancer. If you notice rapid changes to your skin, it's essential to consult a doctor. Number 10. Dark, thickened skin malignant acanthosis nigricans. Malignant acanthosis nigricans presents as dark, velvety, and thickened skin, often occurring in body folds like the neck, groin, and armpits. Unlike its benign counterpart, this form appears suddenly and progresses quickly. It's considered a potential marker for an underlying cancer, including colon cancer. Number 11. Unusual body hair growth. Hypertrichosis lanuginosa acquisita is a rare condition marked by the growth of fine, light-colored hair across the body. This sudden development of downy hair can be an indicator of advanced internal malignancies. If you notice unexplained hair changes, consult a healthcare provider for a comprehensive evaluation. Understanding the risk factors for colon cancer can help you take preventative measures. Some of the primary risk factors include age. Most cases occur in individuals over 50, but younger adults can also be affected. Family history. Having close relatives with colon cancer increases your risk. Diet. A high intake of red and processed meats raises the risk, while a fiber-rich diet can help lower it. Lifestyle. Sedentary behavior, smoking, and excessive alcohol use all contribute to colon cancer risk. Chronic conditions. Inflammatory bowel diseases like Crohn's disease and ulcerative colitis elevate the risk. Colon cancer is often preventable with regular screenings and a healthy lifestyle. To protect your health, start colon cancer screenings by age 45 or earlier if you have risk factors. Maintain a balanced diet rich in fruits, vegetables, and whole grains. Exercise regularly and avoid smoking or heavy alcohol use. Keep in mind that we are not medical doctors, and this information should not be considered medical advice. This video is for informational purposes only. It is always best to check with your doctor for medical advice and treatment. They will know more about your individual condition. Remember to check out our other videos on this channel. Thank you for tuning in. Until next time on Health Info Hub, stay informed, share your thoughts, and subscribe.